Number 3, the Nosori Health Center, all the health centers are doing same problem. Just last week Sunday, I went to meet my grandfather in Vesari, he was sick. We came to Lami Health Center, 7 o'clock, they closed. We came to Valelevu Health Center, 7:30, they said it's closed. And he was having a chest pain. They told us to go to Valelevu Health Center. Then we directly go to CWM. In emergency, we reached there 7:45. So from there, we went inside. They did the ECG, everything, and he was having severe chest pain. 75-year-old man. After that, they gave him morphine. I told the nurse, he's having severe chest pain. Just tell the doctors to see him. Said they are coming. They were having a shift change, or I don't know, maybe 12 or 15 doctors. They're doing their discussion. It's okay, I know, understand. But at least one can come and see. We were there up till 11 p.m. No one attended him, so we just took him to one of the private doctor's friend. So he just told him to rest, and early morning next day, just come. So early morning next day, we went to Dr. Om. So he prescribed him some of the tablets and other stuff. Now he is doing well. So is there anything, oh sorry, for the Nosori Health Center. One day I bring my daughter, she's just 7. She was having severe headache, everything. The nurses checked. Doctor said, only 2 of us were there. They said, shift change. So from 8 o'clock till 9:30, shift change. When we inquire, where is the doctor? Oh, only one doctor. Doctor is in maternity. So I asked the doctor, why didn't the earlier one, you just saw 2 patients were there? At least see and go. Say, no, that's not our problem. Then whose problem? Thank you.
Again, I think the health issue you've raised, it's something that we have to battle with also. As you can see, that government has been allocating a lot more money to the Ministry of Health. Increase the number of doctors also. There's a culture, of course, you know, like the simple example you gave about there was only 2 patients to see, there was shift change. They could have done that. Now, the Minister for Health cannot come at night and get him to do it. It's an attitude towards people's jobs. It's an attitudinal issue. And that's why we constantly, when we talk about, you know, getting the right people for the right job, making sure that people are disciplined, making sure that people do their job. If they don't do their job, they should be disciplined. That's the reason why we say that. And sometimes when we do say that, people get all up in arms. They think, oh, if you're a civil service, once you become a civil servant, you don't have any accountability. You need to have accountability. If you did that in the private hospital, they'll fire you. So we need to bring about that culture also in the civil service. So unfortunately, I mean, we had this issue raised yesterday in Singatoga too, about some of the, you know, health facilities there. And if you look at it, at the end of the day, it all boils down to attitude, the level of commitment to the job, you know, to just go a slightly extra mile. So I'm sorry you have to go through that. But again, like we said, we're expanding, this is why they're expanding the GP services. So if you went, and you can go to the government Facebook page, you can see all the doctors that are on the GP list. If you go to any of those doctors, they'll see you for free. And one of the submissions that have been made to us, in fact yesterday it was made to us by a doctor who's already on the GP list, saying we can provide even more services. You know, like a scan, for example, that they can provide that you don't actually have to go to the hospital for. And they can give you the reports. One of the things we have to be careful about is that when we're paying for things, we have to make sure that the doctor is actually doing the scan because you need a scan. Because they could be just doing a scan for the sake of it to make money too. So, you know, we have to be able to balance that. So those are some of the things that we are looking at.